introduce, I'm really happy to introduce Lisa Nelson, who's a family medicine physician here at CHP Great Barrington Health Center. There's a bio slide that I'll show you in a few minutes, but Lisa's really been a leader here at CHP in developing our group medical visit program. For CHP patients, this is a really very good way to manage some chronic health conditions, and coincidentally, those sorts of approaches to in group health can be very helpful in preventing dementia, which you're going to learn more about. So we'd be happy to get going here. And Cindy, if you want to start the presentation, and I'll turn it over to Lisa.
Actually, so I'll run the slide myself just because there's
Oh,
so
okay.
many
Okay,
buttons,
that's fine.
so it's a little bit easier for me. And I also wanted to, just talk a little bit before the PowerPoint is up, so that I can look at least some of you. So as Ellen said, my name is Lisa. I've been a primary care doctor in the Berkshire since 2005. I kind of can't believe it's been 20 years already. And I have a special interest in kind of integrative approaches, which is not a lot of people, when they hear that, they think kind of complementary and alternative. And really what I mean is recognizing that the body is an integrated whole and that all of our systems work together. Because sometimes I think Western medicine is so beautiful and refined, but our system, we have kind of broken things down by organ system, right? So there are doctors for the heart and doctors for the kidneys and doctors for diabetes. And sometimes we lose the fact that all of these organs are in the same body, and that what is good for the heart is usually good for the brain, is good for the kidneys, is good for our metabolism, is good for our emotional health. And so I like to just, bring that up. And the other thing that's really nice is there's a huge wealth of evidence. There is wonderful research within Western medicine. So that's what I mean when I say this is not alternative by any means. There have been beautiful studies done for years with integrated, multifaceted health interventions. Kind of the premier researcher in this field is Dr. Dean Ornish, who some of you may already know his work with heart disease prevention and cancer prevention. And he's one of the first people who showed that, changing not just one thing, but when we address maybe like 4 or 5 different aspects or domains in our health at the same time, that's really additive and powerful. And he showed that doing that over time in people can not only prevent disease, but can actually kind of start to reverse it. And he famously showed this with heart disease and prostate cancer. And he has also done some studies on cognitive decline. And what's really fun and what I'm going to share with you is he did the same intervention in his heart disease study and his prostate health study and his dementia intervention. So what is good for one organ is good for the rest. And so actually the information tends to be really simple, but it's like, how do we make it happen in our lives, right? Because we are creatures of habit. And so one of the things that Ellen mentioned, and some of our medical group visit participants are here, and maybe at the end, if you feel like sharing, what it's like to do that, how do we create the conditions to really support behavioral change? And we're not talking like crazy, like becoming marathon runners all the time, but just simple, small, important changes over time and how powerful those can be. So we're going to talk about that. And what motivated this particular one is a new study came out called the Maintain Your Brain study that was done in Australia, and it is huge. So the study that Dr. Ornish did around preventing dementia, his integrated lifestyle program, was with 51 people. And so the study that I'm going to share with you, which was an online intervention, had 6,000 participants. So in Western medicine, when we have big studies and they show a positive benefit, we know that this is true and real. So that's what's really exciting about it. The other thing that's exciting is it's not a retrospective study. It's a randomized control study, which means they took people, and I'll share more details, they took people who had risk factors and randomized them and followed them over time. And again, that's like the gold standard in terms of evidence. So one thing that I want to share before I open up the PowerPoint, because somebody brought this up earlier, is there was a beautiful retrospective study of more than 100,000 people done in Europe that was published in 2019 that showed, that looked at people with a high genetic risk, right? So all of us, the role of genes in our health or family history is important and can be concerning for people who have a family history of cancer or heart disease or diabetes or cognitive decline and dementia. And so one of the really encouraging messages is that even if you are at high genetic risk for heart disease or prostate cancer or Alzheimer's dementia, lifestyle still matters. So the study that was published in 2019 showed that people with a favorable lifestyle, and this was about diet and exercise and smoking and alcohol consumption, those people, even who had, kind of the gene that turned on their risk, those folks also were able to lower their risk of dementia by adhering to a healthy lifestyle. So to me, that's just super encouraging, right? That what we do every day and how we live can be really protective, even for those of us at high risk. So what I'd like to say, I'm going to share the PowerPoint and we'll go through those slides. If you have, I try really hard not to use doctor speak, but if I say something that doesn't make sense to you, I would love for you to either, put up your hand if you know how to do that, or just unmute and say, Dr. Nelson, slow down. What do you mean by this, right? Clarifying questions are super welcome. You can also put comments. If you want to share something, feel free to put that in the chat. Or if you have a question and feel just more comfortable putting your question in the chat, and Ellen and Cindy will kind of keep an eye on that, and they can interrupt me. Okay, so does that sound good? All right, so I'm going to get rolling, and hopefully we will finish in time so that we can again come back as a group and answer any questions you might have. All right, so here's where the technology, let's see how I do here. Okay. So can you all see this slide? Catherine, Ross, nod for me. Good, because you're on my screen. Okay. And actually, let me shrink this. Okay. Oops. All right, so you don't need this bio slide. I told you I've been doing this for more than 20 years, and I really focus on preventive medicine in addition to primary care. So you can read this later if you're interested. So this is, I hope, only the only discouraging slide that I have. But dementia is a common issue. Right now, about 5.8 million people in the US have dementia. No surprise, right? This primarily affects those of us who are older. And again, one of the reasons why we want to spread this information is right now, if nothing changes, the number of people with Alzheimer's is predicted to rise to 14 million. Okay. So if we kind of keep living the American lifestyle, right, we may see this disorder escalate, but it does not have to be this way. So the good news that dementia, right? Alzheimer's or other types, just like any other chronic disease, like diabetes, like cancer, like heart disease, can be prevented or delayed. So this is the study that I was talking about, the Maintain Your Brain study, that showed that the intervention that focused on 4 different domains I'm going to talk about was able to improve people's cognition in a clinically significant way over the 3-year study time. So again, as I said, this was a big study, and so that's really exciting. So they took more than 6,000 Australians between the ages of 55 and 77. And to me, this is more good news, right? So they took people who didn't have perfect lifestyles. I think sometimes people worry or might feel bad, kind of looking at our lives and we're like, oh, it's winter, I'm not moving, I haven't been able to exercise, or it's been a stressful time, so I'm back on the sugar, the pizza, or whatever. But the good news is that this study really focused on people who already had 2 risk factors for dementia, right? So either their diet wasn't optimal, they weren't moving, they weren't doing a lot of activities. So sometimes folks, when they retire, they disengage with society and their brain isn't active, right? Or they struggled with depression or anxiety. So it's not like the study took people with optimal lifestyle, right? And showed that those people maintained their cognitive health. They were really taking people at risk. And there was no typical control arm. And that's also pretty cool. So one group received pretty intensive online coaching that was very personalized. So identified what is the area where you need some help and really tried to get them going, whether it was with food or with movement or brain training. The other group just received information like you're receiving here. And the fantastic news is that people who were able to make changes based on that information also showed improvements in their cognitive score. So while coaching is really helpful, right, and the improvements were a little bit higher in that group, just learning about it, just bringing attention, still helped. So again, they studied cognition at baseline and then again at 3 years. And that's how they could see that people who adhered, right, who tried, who made changes, showed cognitive improvement. So again, the folks who got the coaching, so that's why I want to spend some time at the end really thinking, are there ways for those of you who are CHP patients, can you utilize some of our resources so that we can help you stay on track? Or are there people in your life where you can, just use your own social support to really help enhance? Again, we're an integrated whole. So it's not just the brain that improved, right? This makes sense. So there were improvements in people's strength, in how much they moved, and folks were less depressed at the end of the study. They also noted that starting earlier seemed to make a difference. And so this means that we should really spread the word with family members and younger individuals in our community, right? Because this is about prevention. So we can always make, no matter how old we are, we can help improve outcomes. But by really building these habits earlier, there can be even bigger improvements. So this is what I want to help y'all with today, is thinking about, okay, how can you, because the actual study, right, that was pretty intensive, and we do not have a Maintain Your Brain program here in the Berkshires, but I believe that we can build them, right, that you can build them based on your own assessment, and that we can offer tools to help. So we're going to focus on the same 4 domains. And, let's start here, right? Let food be thy medicine. I want to borrow from something I heard Dr. Mark Hyman say years ago, that food is like your environment washing over your genes. Okay, food is your environment washing over your genes. Food contains phytochemicals and micronutrients that are profoundly biologically active. And so, what this means is that they actually have the potential to turn on certain aspect of your genes. We call this epigenetics. That food can be a potent regulator of positive health processes with immune function, reducing inflammation, right? So, when we follow the dietary pattern that I'm about to talk about, we really promote on the genetic level, okay, the protective components, right, that help protect our brain. Conversely, and this is why they took people at risk, right? When our nutrition isn't optimal, that's where we are going to see some derangements in how we process sugar, right? Our blood glucose is going to be higher. That hyperglycemia is really disease promoting in a lot of different ways. Inflammation, right? There are some foods that can be pro-inflammatory. So I want to really share with you the dietary pattern that has been most studied, okay, that I bet many of you have heard about, the Mediterranean diet. If you're interested, you can Google Mediterranean diet and just about any chronic disease and see that it has been studied and has been shown to be helpful. Some of the biggest ones, most clear, are around blood pressure, kidney disease, diabetes prevention, heart disease, dementia, and also depression. So, which I think is always interesting for people to think about the link between food and mood. And what I want to really, highlight here is this is not a diet as in focusing on weight loss. So weight loss was not part of this at all. Okay, we've sent a lot of messages out as a medical community in ways that I think have been a little bit harmful at times, that the weight is the problem. I believe, and I believe this is really supported by the evidence, that it's our food quality, right, and not quantity. And again, think of food as all these components that really affect our physiology. So, what does the Mediterranean diet include? Heavy in vegetables, fruits, legumes. So by that we mean peanuts and beans primarily. Whole grains, nuts, seeds, extra virgin oil, but not exclusively. So you can still, have a little bit of butter in there and canola oil and other oils, right? Shellfish has a lot of beautiful minerals and micronutrients. And fish, these things that are a little bit lower on the food chain, tend to be easier for our body to manage. So the Mediterranean diet also recommends a lower amount of red meat in particular, dairy in moderation, eggs, really minimal processed sugars if possible, and focusing more on the vegetable fats, like again, avocado and olive oil, and a little bit less, the animal fats like bacon and things like that. One more thing that I want to say about diet, because it can be stressful, right? Thinking how powerful it is can also sometimes make us anxious. So I do not believe that we need to be perfect. There's a common rule people like to think about that's 80-20. And I think this is really good enough, that if 80% of the time we're really following these principles, that it's okay 20% of the time if we want to enjoy our pizza, our brownie, the potato chips, right? Like it does not have to be perfect. And in some ways, the less optimal your diet is now, the more you're really going to get a benefit from small changes. And of course, we have nutritionists who can help if you need more advice on this. So one of the little mantras that I think can be helpful is beans, greens, nuts, and seeds. This is what I've pictured here. But other people like to think of eating the rainbow. Maybe you've heard about that before, really focusing on the color and food variety. And again, color relates to the particular antioxidants and phytonutrients. And so sometimes that's just a fun way to, and I think Nancy, I saw you on this call. Nancy is who brought this up in our group visit the other day. And I thought, I want to mention that again. So thinking about, each week or maybe even each day, adding a different color, bringing in the yams for orange, the blueberries, the reds, the whites, the browns, the dark greens, the bright greens. That can be a fun way to just liven up your diet and know that when you bring in the different colors, you are bringing in a diverse and micronutrient rich diet. All right, so that is it on food. I want to talk about movement. Believe it or not, exercise is probably the best studied and most important aspect of brain health. There is just abundant research showing that moving our bodies is critical to our brain, and that we can talk a little bit more about what's going on there and why it's so brain protective. But I just want to share with you what they did in the study. So they had a pretty high goal in the Maintain Your Brain study. They recommended 300 minutes, so that's 5 hours, that's a lot, of moderate movement each week, or 150 of vigorous movement. They also encouraged people to do balance training and strength training. So because the data is so strong on movement as being protective of our brains, they put a lot of energy in kind of upping the bar on exercise goals. So if that sounds like a lot to you, I want to share that a lot of other studies that have also shown protective benefits, like the Diabetes Prevention Program, have had a slightly lower goal of 150 minutes per week of just moderate activity like walking, that took people at risk for diabetes, so they had prediabetes, and shown a significant reduction in folks who went on to develop diabetes. The other thing that's important to remember is that some is better than zero. And so some other studies have shown that just getting from zero to any is actually the most profound change. And even if we've spent our whole lives being inactive, there are studies that have focused on people who didn't even start to exercise until well into their 50s. And we can still gain the benefits from it. So wherever you are, going from none to some, or you're already at 150 and you want to push it to 300, you're going to see a benefit. For those of you who might also be thinking about bone health, right? So either treating or preventing osteoporosis, some exercises truly are better than others when we're thinking about our bones. So we want weight bearing. So this is where walking or jogging might be better than, say, swimming or riding an exercise bicycle. Okay. And it doesn't have to be the only thing you do. You can break it up, but every once in a while I meet with patients who their only, especially in the winter, their only exercise is swimming. And so that's going to be great for mood and for some other, brain health. But if we want to think about our bones, we want to make sure that we're also getting that weight bearing in. Not just exercise, but especially as we age, right? We want to think about agility and balance. And so balance training was part of this intervention, and going outside the box a little bit, things like qigong, yoga, physical therapy, cardiac rehab. These are all things that can also be really helpful in all of these domains. And, right, given what I just said, it is still true that the best exercise that you can do is the one that you like the best. So that is the most important. Whatever you feel like you're going to do, be it dance, swimming, biking, walking around your house, walking in the mall, that is the best exercise for you. So are there any questions? Again, feel free to just unmute, shoot me a question, put it in the chat.
Lisa, I have a question. It's Ellen.
Mhm.
When you talk about exercise and
Yeah,
movement for
yeah.
somebody who might not have had an active life,
Mhm.
maybe they've got some physical stuff that makes it hard. What, what, how do you define movement and what is considered movement and exercise? Like you said, you don't have to run a marathon, but what
Right.
kinds of activities are going to kind of fit into this model?
Yeah, I mean, literally, I mean movement. So, so chair yoga, right? There is movement, and we do this every Tuesday at 4:30 and Wednesday at noon. Chair yoga is movement that can be done sitting in a chair. So there is a big difference between, what I'm doing when after a hard day's work, when I'm sitting on the couch and I'm watching TV, I am not moving anything, right? But when I do chair yoga with Mary Northey on Tuesdays, right, we're moving all the joints. We are improving circulation. We are standing with the chair support. We're working on balance. So it could be as simple as that. It could be literally, I have patients who walk up and down the stairs in their house, who realize that during winter they feel worried about the ice outside or the inclement weather. And so they are doing loops in their house. Other folks really hate anything with a taint of exercise, but they find that dance, right? And they don't think of dance as exercise. So they're doing Zumba or they're doing ballroom dancing or they're following YouTubes. So really, literally anything that moves part of your body triggers synapses in your brain, right? If we're standing up, if we're bringing in balance and visual cues, we're working different parts of the brain and growing neural networks. So I'm going to talk about this a little bit more with brain training, but especially when we combine movement with hearing, with vision, with balance. If you think about where, like the parts of the brain that all of those activities light up, that's really the clue to why this prevents dementia, why it really improves our cognition. Because unlike doing, a crossword puzzle, like we are really activating, anywhere from 5 to 12 different areas of the brain and enhancing those neural networks and literally building new neural connections that grow the brain and protect the brain. So that was a super long answer. I hope that was okay. Okay, we're at 12:30, so I'm gonna move on. But again, please interrupt if you have a thought or a question. This slide maybe goes a little bit more into the next domain we're going to talk about, which is emotional health. But when a lot of times people do their movement outside, which is wonderful, right? But I want to also let people know that simply being outside in a practice called forest bathing, and this has best been studied in Japan and Korea. So forest bathing is literally taking in the outdoor environment. It doesn't even need to be a forest. Any place pleasant and outside, not even moving, but just taking it in, has been found to have a lot of the same benefits as exercise, interestingly enough. So there's just something about that natural environment that humans are environmentally, evolutionarily adapted toward. And when we're just resting and taking in the scenery, you can see really important improvements, lowering heart rate, lowering blood pressure, lowering our stress hormones, improvements in mood, improvements in attention, reduction in anxiety and depression. So for people who really may have, limited capacity to move, being hospitalized recently, being confined to a wheelchair, it is still, we can still get benefits just by being outside. So not to be totally discouraged if there are real and true limitations on your ability to move. And I would really recommend time in nature as a beautiful substitute or addition. Was there a question on this? Okay. All right. So the third domain in the study was about emotional health. And before I talk about what the Maintain Your Brain did, I want to highlight a study from Sweden that looked at depression and chronic stress and found that they were both independent risk factors for cognitive impairment. And what they noticed, I think more significantly, is that people who suffered from both had nearly double the risk. So this is, again, our integrated organism here, right? And while good things, are additive, stressors can also be additive and worsen our health. So I would say this is one area where, Dean Ornish really focuses, and where the Maintain Your Brain was a little bit unusual is sometimes in studies we focus a little more on diet and exercise, and we omit that emotional component. And so I thought this was a really lovely aspect of this study. Before I get to the Maintain Your Brain, I just want to say, and I hope we have time, so I'm gonna go through these really quickly. Just like two things on stress, just to help people understand why emotional health is so important, right? Stress, not a bad thing, very adaptive, very healthy in the right dose. When we talk about stress, what we're really thinking about is the sympathetic nervous system, okay? Again, very appropriate, helps us respond to threats and prepares our body and mind for action, but it is designed, our fight or flight system is designed to be short term. So when we are in a state of chronic stress, we are engaging in systems. We are asking our body to kind of mount this response that becomes very fatiguing over time, and that is often disease promoting through, again, inflammation, hyperglycemia, and emotional dysregulation. So we see, just like with dementia, like from that Swedish study, chronic stress really increases our risk for cancer, heart disease, dementia, all of those things. Fortunately, there's a cure also for chronic stress. The other half of our nervous system, what we call the parasympathetic nervous system, or rest and digest, when we engage that, we really turn off those disease promoting processes. We have more of a sense of calm, heart rate slows, blood pressure slows, very similar to what's happening with forest therapy or forest bathing, like I mentioned. We see improved circulation, digestion, muscular tension comes down, emotional regulation comes back on board, and the processes that support health can come back on board. So one of the reasons why I wanted to just briefly talk about stress physiology is that there's a lot of data now on practices like meditation and mindfulness and yoga that show that those in particular are very helpful in boosting our parasympathetic nervous system, or our rest and digest system. And the physiology for this is really about slow breathing. And if you come to our Tuesday and Wednesday group, you'll learn more about this. But I wanted to share this to explain, this is why we're offering the chair yoga and mindfulness and meditation. It's not just random. It's because it's really powerful physiologically. And again, maybe some of the folks in the group when we break in just a minute can speak to that. But I wanted to give a little bit more on the physiology of why and how this helps. So I think I worried. Okay, so before I talk about exercising your brain, sorry about this, and forgive me if I missed a slide. What the Maintain Your Brain did for emotional health was they enlisted a CBT type program that was online that really focused on reducing symptoms of depression and anxiety. Um, and built that in as one of for the folks who were at risk, really built those tools for improving mood and provided some support, right? So cognitive behavioral therapy is one of the things that can work. Counseling can work, but truly any emotional support, right, can be really helpful for reducing the chronic stress that is disease promoting. Okay, so here's the last thing we're going to talk about. Another thing that was a little bit unique in this study is they wanted to bring in brain training, okay? So like reduce that cognitive inactivity that some folks were experiencing. So they targeted 7 cognitive functions around verbal executive functioning, memory, visual attention, and working memory. And they, again, offered these targeted programs to help people with engaging these different aspects, right? And again, verbal, what I was mentioning before, really thinking about the different part, listening, seeing, moving, thinking, right? And how that activates different networks in your brain. What I want to let you know is of all the areas studied, I would say there is the least evidence on what we often tend to think about, or your algorithm may shoot you recommendations for around brain training. So a lot of the games that are out there, or companies who are kind of selling products, saying that they have good brain training, there often isn't a lot of great evidence on it. Again, the evidence for physical exercise is much stronger. So what I feel is really important is, limiting cognitive inactivity where we're just passively receiving something. And again, it's not that TV is bad. I do it, 5 nights a week sometimes, right? We all need a little bit of rest, but we also want to think about not falling into ruts and making sure that we have the stimulation that we need. So it's not that these puzzles are not good, but there isn't a lot of great data on them. And so, if they're fun for you, absolutely do them. But what is probably more helpful are these integrative, stimulating activities like learning a new language, learning a new musical instrument, or, and I decided to do this myself this week, just thinking about this talk, if there's something that you learned in childhood, like you studied piano or you studied sax, or go back to it. That is going to bring all of that stored information, re-excite those synapses, grow those parts of the brain again. So learning a new one is really wonderful, right? But just relearning that old one is also going to be super, super helpful. And learning a new dance or a sport, bringing in exercise, combining cognitive activity with movement is so stimulating for the brain. So if you're up for something truly new, ballroom dance, there's some Latin dance classes in Pittsfield. That's what I'm going to give a try later this spring. So again, really thinking about engaging the senses, what we feel, what we hear, what we see in combination with thinking, remembering, and moving. That is where the money is, I believe. Okay, so this is the summary slide, and I get to stop talking soon. Good. Okay, so that whole foods, plant-rich diet, um, with the beans, greens, nuts, and seeds, movement. Again, anything better than nothing. Goal, just thinking 30 minutes a day on average. The Maintain Your Brain study didn't talk about alcohol, but we know that alcohol is really in excess is really harmful on our brain, is really a neurotoxin as well as being hard on the heart. So they have really changed the recommendations for people. For women, it is definitely less than one serving a day. For men, less than two. I would say if we're thinking about brain health, my recommendation would be less than one a day or none at all. And again, there are, you have to think about the role of alcohol and pleasure and community. And, so I'm not going to say never, but I think it's important to recognize the role that alcohol plays. Cigarette smoking, same. Cultivate an active emotional support network of friends and families, religious communities. Take breathing breaks. If you don't have a meditation practice, that's okay, but just taking a moment, setting something on your phone, just relaxing for 1 to 2 minutes can really help break that stress cycle. I should probably, if it's okay to say, taking breaks from the news, right? Things are pretty weird right now. So I generally encourage the people I work with to take breaks from the onslaught of doom scrolling, right? And just take some time to rest and digest and learn new things and sleep. So, nourishing foods, nourishing friends, nourishing play. Here is information about this is, I would say, a form of play that we have. This is more information about the group that we have, and you are welcome to join. I think what I'll do is put my email in the chat. And if you're interested in joining either the Tuesday group or the Wednesday group, you can shoot me an email and I'll send you the link. And the wonderful Ashley Miner has been a nutritionist for years. She is brilliant and up to date on all of the latest science on the role of nutrition and health. There are wonderful things happening in our community and in communities everywhere. Ellen put together this nice list. Here are some local and non-local yoga with Adriene. She's some of her, I would focus on the gentle. And that's it for me. All right, I'm gonna stop the share and hope that some of you are still here.
Lisa, can I throw in a couple of comments based on that last slide?
Yes, please, please, please.
There's a couple things about social media. There is if you kind of find yourself getting sucked into that vortex now and then, you can go online and download an extension to your browser. Like if you use Google or Firefox, it's called Facebook News Eradicator. And you're not giving up your Facebook account. But what it does is it eliminates that feed, that random feed that you get, which is just can be kind of toxic. You can undo it at any minute, but you also can keep your access to your groups. Like if you have a hiking group or a reading group or something, you don't lose that, but you lose that kind of crazy feed. So that's another thing. The other thing is, I want to say something about senior centers. Senior centers have struggled with a bit of a stigma. They've kind of people think of senior centers as being a certain type of place for people who might be elderly, perhaps of a certain demographic, and not an exciting place. But I'm telling you, if you have a chance to explore your local senior center, it's incredible what's going on in senior centers these days. And they're very cheap programs, whether it's an art class or a yoga class or a tap dancing class. These things are very accessible and the people are great. And this is not the senior center of 30 years ago. So explore your local senior center. And all of these senior centers will open their programs to anyone, no matter how old you are. So I went and did an art class in Great Barrington not long ago, and it was a blast, and it was like $3. So check out the free accessible things right in your hometowns, as well as libraries. And that's it.
Beautiful.
Does anyone have any comments, questions? Would you like, I see there are some things coming in on the chat. This is great. I'm just looking through the questions.
I'm gonna answer the one on supplements because that's people usually ask that one. There, personally, I feel like there has not been super strong convincing evidence on the use of supplements for brain health or many chronic disease prevention. Some of the best is the AREDS formulas for macular degeneration, but we kind of bring out supplements and study and do these large trials, even for vitamin D, that tend not to show a great benefit. So this is where I feel like food, if you can get your nutrition from food with everything packaged in a way that, kind of nature intended, easier for us to absorb. A lot of the supplements are kind of low quality and hard to absorb, and we tend to just excrete. So I always like to recommend that people save their money and get some high quality, fruit and vegetables, and think about eating the rainbow, because things like raspberries and blueberries can be expensive. Frozen, also, by the way, a really great way to do those. That said, if people are, have Crohn's disease or recovering from cancer, and getting that whole foods is difficult because the digestive tract has shut down, it may be helpful to add some of the supplements. So again, I don't want to say never, but in general, save your money if you can get the nutrients from food. Really lovely studies showing around dietary calcium, showing that's really far preferable than supplemental calcium. Anyway, so save your money, buy some food, buy and enjoy food.
Can all of you please also put in the chat how you heard about this event? We've still got time for a few questions, but before you leave, please tell us how you heard about this. It helps us with our planning.
And I don't want to put, but I'm going to, sorry, Betsy and Jim or Catherine on the spot, but would you be open to sharing why you've decided to join the groups and what you feel it's helpful with? Jim and Betsy, I see you're outside. So if it's hard to unmute and you don't want to, that's okay.
Hi, Lisa. For one, it was the email from CHP, and I enjoy the chair yoga weekly. Wish it was daily. And because I'm a little older, figured I, got to keep your mind sharp.
I'm in to see profile.
Thank you, Catherine.
You're welcome.
Can't get unmuted.
Yeah, you look good, Betsy.
Oh, we are unmuted. Oh, okay.
Yeah.
Go ahead.
Well, I don't want to take a lot of time, but I always tell a story that when Lisa started the groups, our Tuesday group 6 years ago, I think it's been, my wife couldn't go at that time, and she's a patient of Dr. Lisa's, and I'm a patient of Dr. Ausdorf. So I said, well, I'll go and let you know what it's like. And consequently, I've missed very few meetings in 6 years.
Way more than I've missed.
And it's been extremely beneficial. And we've covered everything from diet to breathing to nutrition to chair yoga. It's been a marvelous experience.
It's really phenomenal. In fact, I took a break for a while. I started birding, so I was out walking a lot and a lot more. And and I needed a break. So I took a break, but I'm ready to come back because it's middle of the winter, and the movement in the chair yoga does matter. And
Mhm.
and you can do as much or as little, and Mary lets you decide how much you're going to do or not. And so I need to get back to that and plan to. So, and Jim and I, of course, are way older than the study. So, we're already way beyond the study. It's just an amazing thing how the 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 community of the group has it morphs, it does, but it's very supportive, and it just helps you feel better.
Lisa, we have a question from Karen, who says she has a brain disorder called Chiari malformation, and it's a chronic pain. She has a lot of chronic pain. Does chronic pain put you at higher risk?
That is a great question, Karen. And so many things become very tangled, interrelated. Folks with chronic pain are going to have more stress. They're at higher risk for depression and anxiety. There's going to be, often some limited movement. And so, I'd have to do the Google ask, about the association, but I can certainly see mechanisms where, the result of struggling with chronic pain could result in increased risk factors. And so, the way that I'd want to address that is, even if we can't fix the chronic pain, are there ways that we can work with the pain? And this is really what we do in the groups on Tuesday, to kind of work with what is and relax around it if possible, and work on that stress component, work on building, reducing the social isolation that comes from chronic pain, right? Reduce the depression and anxiety, right? So I would really want to kind of work with, okay, how is this affecting you? And are there ways, even if we can't fit, and not just right chronic pain, but kind of think about any disease process that might be limiting, and look really carefully and think, okay, well, given those limitations, what else can we maximize? And so before we break, what I want to, kind of recommend is for you to think about your primary care, NP or MD as a coach of sorts, and to feel free to use them as a resource and say, hey, I really want to start thinking about my cognitive health. And can you work with me on a plan? Or could I see you every 2 months for a little bit? Or so until we really get a hold of this. And we the Tuesday group, one of the things that I do is I stay after at the end of it to answer people's medical questions. So if people want to try out the group and they have a question, or something that they're working on, know that this is also a way to access a health professional. So it's me on Tuesdays, and it's our wonderful psychiatric nurse practitioner on Wednesdays, Kim Loring, who is fabulous. And so, you can do the practice with Mary and the group, but if you have a question that you need additional support on, we are also there to help you with that question. And weekly attendance is not needed. This is something you can drop in and drop out. So I've put my my email in the chat. It's lnelson@chpberkshires.org. And so if you're interested in getting the link, I will, or if you have questions about it, I'm happy to set up a meeting with you, or just send you the link and you can try it.
Lisa, I would just clarify, and you can correct me on any of this, but you have to be a CHP patient, an established CHP patient, to join group medical. It's not a substitute for your primary care provider. Is that correct, Lisa?
Well, it's not a substitute for your primary care provider. We do have one person who has ever been a CHP patient, but who is followed elsewhere. And so there, we may be able to, we definitely can't do it like out of state.
Yeah.
But I know at least one person who was with CHP now is elsewhere who we've been able to make it work. So we can always do a case by case.
Oh, that's great. That's really good news. I'm happy to be corrected on that.
But for CHP patients, absolutely.
And it is just like a regular medical visit in that group medical visit is billed to your insurance. So it's treated as a visit, a medical visit.
Yeah. So for people who, for Medicaid and much Medicare, I think there isn't a copay. But yes, to be aware that there may be a copay. We're trying to, if the copay is a barrier, we'd also want to hear about that because we really want to make these accessible for people because, you know, our last Surgeon General really feels like the social isolation that we're experiencing is the new pandemic. So we really want to make opportunities for folks to come together and support one another as accessible as possible. So if that would be a barrier, just let me know and we'll see if we can help you with that.
Lisa, do you know where someone can find a Qigong class?
There is, feel free to email me. Ken Nelson has an online Qigong program. He's just one person who I'm thinking of. Sometimes the local senior centers will do a Qigong class. But I'll look up some resources, but I'd also recommend Qigong Berkshires, Google search. But I'm happy to pass on Ken Nelson's info because he's wonderful. I want to, just because I know people might have to leave right at 1, I want to thank everybody so much for coming. This is a great turnout. And I just appreciate your interest and willingness to join us in the middle of the day on a Thursday.
Thank you, everyone. We're really happy that so many people joined us today. This has been great. And we will be sending out the PowerPoint, and inside that PowerPoint will be a link to the video. And if there's anything we can add, I'll speak briefly with Lisa, you know, about some additional resources that came up during the conversation. So I'm going to leave this on for another 5-10 minutes. If any of you want to ask a few more questions, Lisa, you may have to get off, but I'm happy to hang around, and if I can answer anything, I will.
My next meeting is at 1:15, so I definitely have another 5 or 10. Thank you, Chuck. Thanks everybody for coming. Maria Getoff, wonderful to see you. And if anybody has any questions, just feel free to unmute and
Lisa,